If I have saved 4 bicuspid extractions in a case, I have saved a lot of time, a lot of trauma to the teeth. There seems to be a little bit of input so that the mandible actually grows a little bit better when we treat it in the class 2. It's not anything to knock your hat off, but it is subtle and it is there. So I think even in your race, there is a possibility of using extraoral traction if you have high convexity. We don't use it with straight profiles because you're probably going to produce a flat face. Now, if I do put extraoral traction on the face, on the maxillary arch, actually the palate is tipped downward. This whole complex is rotated. We open up the frontal nasal suture. We open up the zygomatical frontal suture. And we compress this suture. We compress this suture. And as we expand it, this naturally slips to the buccal, doesn't it? There's a plane here that I'm scooting this out on. So put expansion and rotation into it, and the palate will tip and the palate will split. It was a thumb sucker, but you can also see the adenoid right here. This is a negative. You can also see the tonsil right here. This child is probably a mouth breather. One reason I believe that is because the tongue is away from the soft palate right here. You can see the strain in the lips. You can see the upward tipping of the nose. And so we're going to attempt to treat this patient with extraoral therapy. Looking in the frontal, if you notice, the nasal cavity is narrow. There's just an early beginning of a little bit of an S shape in the septum, but not bad. So here she is now, at the age of 8. Now many people around the United States, around the world, would not treat her at this age. They would wait until all the permanent teeth are in, or at least until the canines and premolars had erupted. She has 9 millimeters of convexity. Now, if we could get a hold of this whole maxilla without surgery, hold it and push it back, wouldn't that be a great service to that patient? So that's precisely what we did. In fact, we had to put a utility arch in her lower arch to move this out of the way so that we could reduce the maxilla. This was just when she was bracketed in the upper incisor. And here she is at age 8. And we got her here at age 11. And you see she still has the deciduous teeth. So she hasn't developed her permanent teeth yet. But now she's got 4 millimeters convexity. And even though it's 3 years, and if you notice, the chin actually moved forward. Now, how in the world could you do this? Get the chin to move forward while you're moving the maxilla back. We'll observe the bend in the mandible and the vertical growth of the ramus. There's the nasal cavity before. Here's the nasal cavity after. There's no question that there is something that's happened other than what natural growth would be. Here's the 4-position analysis. Notice that she has been moved back 5 millimeters, 5 degrees. She's been tipped 5 degrees and moved back. Basion Nasion A has gone back 6 degrees. Now the real pleasurable part of this is that we moved the teeth very little. There's not much trauma on these teeth. The deciduous teeth had done the correction. There was no appliance on them. Here she is now at 15. And it looks though she may have room for third molars. Here's another one. Here she is being treated with a headgear. She was a very severe class 2. Look at the tip of the palate. You're looking right into her nose holes right here. And what she needs is orthopedics here in the mid-face. And there we are with 2 bands and a headgear. Now, in the frontal, the same phenomenon. She was starting to develop a deviated septum. She's 23 millimeters wide. Now here she is after. She's 28 millimeters wide. with extraoral therapy. The upper molar has been widened from 55 to 61 millimeters. Here she was at the beginning.
治療開始当時の写真。
Now look at the width of the nasal cavity now.
途中
Here's
の
the
で
changes in her. Here's the maxillary
今の
change.
患者のこれは重ね合わせで見たところですが上顎
Essentially no movement of the teeth. Here she was. You're looking at her nose hole. Now you put the headgear on, pull the whole complex back.
ね
Here she was before. Notice
こう
how
なっていたんですね
the nose is up and the
鼻が
upper
上向きになって
jaw is out.
それから
This is during the treatment with the
術
neck
中の
strap.
写真
Two bands.
バンドはこうです
Now as we treat her, here she is, age 9. We usually see a full correction within a year, and then we hold it for a year. Now here she is at 15. I think that's interesting. This would be the ear rod holder. We have a mark that is 15 millimeters, 1.5 centimeters above the ear rod. At the center of the eye is 15 millimeters above orbitalis. What I do for the lateral is to set the patient upright
患者をまずまっすぐ座らせます背を伸ば
in
して
their natural posture. The chair is raised
チェアを上げます
and the chair is moved until the ear rods are directly lateral to the ear holes.
で調
So
整するわけで
patients
す
may have to be changed just a little bit one way or the other because they're asymmetric. With them in their natural posture, the patient then has the ear rods inserted.
でイヤ
We have pads on the edges so that a part of the pressure will be taken up by the pads on the ear rod holders. There's a ratchet that turns both sides at once, so they both come together.
でこの両方がこう線がついていて一
The
緒
ear
に
rods are inserted and the ear rods are small enough that they will go in the internal canal.
で
So we want to insert the ear rods and then let the chair down very, very slowly. The ear rods are seated up against the ear holes. Now, the next instruction is to close the teeth in their natural center. So we have the patient close the jaws. Do not hold the breath because when that happens, the soft palate will be held up against the roof of the nasopharynx. Now, here's where there's some disagreement in the field. It's my preference that when they close the jaws in their centric,
で私の好む方法としてはセントリックで閉じる際に
that they also close the lips. I want to see what the muscles are doing when they make a lip seal, because every time they swallow, they have to bring the lips together in order to make the swallow.
なぜなら
Some people will have the lips at repose. They'll leave the lips in a relaxed state.
口唇がリラックスした状態に弛緩した状態になっています
It's difficult for me to determine how much of a problem I have to treat if they're hanging loose here. I don't know how much strain there is in the mouth. I can't read it. Now in this posture, in their natural posture, I can see where the vertebrae are in their natural position. I can see the soft palate and the natural positioning of the tongue. Notice that I didn't say that we orient the patient to Frankfurt plane for the lateral film. So let me repeat.
もう一回申し上げます
Frankfurt is not parallel intentionally
故意に
in the lateral film.
ラテラル
Okay. For the frontal, the problem is obtaining Frankfurt orientation. Because if one film's taken like this and another is taken like this, you can't compare them later. So in the frontal, we're obliged to orient the patient to the Frankfurt plane. Now the easiest way and the surest way and the quickest way we have found is to seat the patient normally
患者を普通に座らせて
and then line up the canthus of the eye to that mark on the X-ray holder.
で
Because orbitally is 15 millimeters below on average,
なぜならば平均で
and it's easier to see the lateral canthus than it is to palpate for orbitally. And when we started doing this, our x-rays improved immensely.
この
Now you'll notice here in this x-ray, I traced in the eyeball,
ここで
and when you get correct orientation, the petrous portion of the bone is just very slightly below the center of the eye. Now, years ago when anthropology first started, they measured the left side of the face. Now when Broadbent came along with the technique, because anthropologists had measured the left side, he put the left side next to the film.
顔の左側と合わせた
That would be enlarged the least. So that x-ray beam is coming from that one point. The further it goes, the bigger it gets. Because when he started, he measured the left side of the face and did not measure the right side. Then we came to bisecting the right and left side. So we'd have one common midline
ですからそ
as a
の
representation of the patient. When we take an x-ray, and this is 5 feet away, there's a 5 to 6% enlargement. By the time you get to the midline, it's about 6%.
ね
So now we're going to trace the lateral film. Now what I'm going to do is to trace this. 1, 2, 3, 4, 5. So we're going to start out here.
ここから始めます。5番目のところ。
And I'm bisecting the two sides of the vertebra also. Can you all see that?
見えますか？
Now I'm looking here at the spacing
これスペースを気をつけてます。
and the form of these vertebrae.
していま
I'm
す
looking for a slight lordotic curve. I'm using a number 9 lead, 9 millimeter, 9/10 millimeter lead.
失礼。
I like this because if I want to make a print or make a, remember I told you that you'll see a little knob here? What that is the facet or the articulation of the atlas. Here's the atlas,
これが貫通
and there's the anterior arch of it.
で、それの前球です。
Right here's the posterior arch.
後球。
Now this comes all the way down, and if you remember that
これはずっと降りてきま
is
す。
a
こ
wedge shape,
れくさび状、筒状です。
and it comes all the way up here.
で、こういう風にきます。まあ、上に来て。
See what I did?
わかりま
That's
す
the
か？
outside of it.
これが外側の部分です。
Because the occipital condyle fits down in here.
こういう風に来てるんです。そこに出てるのが。
So here, right there is the Spinoccipital Cytochondrosis.
これ
We'll
が
take that off now.
今の部分は消してしまいます。
But that's just for identification in an 8-year-old.
次にやるとこ。
There we go. Super, super. Because now you have the body of the sphenoid, and sometimes it looks like here
長頸骨の
that
骨
it's
体
all
な
the
んで
way
す
up
けど
to
も、
here.
ずっとここまであるように見えるんです。
But the problem is sorting out now the great wing of the sphenoid,
ここでまずこの大翼がどこかというのを決めなくてはいけません。こう上に上がっていく部分、
and the horizontal portion,
それから水平
which
の部分、
comes back.
これ後ろに来る部分ですけど、それを見極めなくてはいけません。
If you remember, this horizontal portion terminates all the way back here in the spinous process of the sphenoid. Now we'll take this off again.
じゃあこれで一回書いたのを消して、
And my view is that this is the body of the sphenoid right here.
こ
Now
れ
coming
が
down
多
right
分長頸
here,
骨の骨体です。
you sometimes don't know whether that is the medial pterygoid plate
で果たしてこれが内側翼突板なのか分からな
or
い
the
ことがあ
bomber
ります。
coming down.
あるいは除骨が降りてきている部分なのか区別がつかないことがありま
They
す。
both terminate right here near
両方とも
the hard palate. So it's a little difficult sometimes to see.
場合によって
But
は
I
見え
see
に
a
くいことがありますけ
transverse
ども、
line, a little light shaded line coming
こ
over
う少
here,
し薄い線ですけども、こういうふうに走って
and
ま
it
すの
runs
で、
up to there.
横方向に、それからこういうふうに分かります。
So that looks to me like the vomer bone right there.
これは
And we'll come up to the top of this.
次にこの上の部分、
This is the anterior clinoid process. Sometimes you'll see a middle clinoid process.
ク
It'll
レ
be
ノイ
right
ド
there.
プロセス、場合によってその中央の部分が見えます。この部分
This
で
is
す。
the posterior clinoid process.
これはこの後方のプロセスです
Now I see two lines, one starting here.
2本の線が見えます。一つはこういうふう
One starting there.
に、もう一つこっち。
These looks like the great wing is superimposed over each other right
これは
there. Now right here, there is a right and left sides
これ右と左があります。
on the pterygopalatine fossa. I'll dot in the one that is posterior.
で、後方の部分は点線で書き入れておきます。奥の方です。
Then I will dot in the one that's
で、
anterior.
次に、
So if I trace that now, what I want to do is to bisect
こ
those.
れとね、
Now the pterygopalatine fossa
次に
really
肋
is
骨
not
外
continuous.
というのは連続してないんです。
It's
実は
open because this is the infraorbital fissure.
これ
But
は
because the great wing comes out here
ただ大学もここまで伸びてきてるんで、
and
大
comes
学
over
が
the top
でこういうふうに上にかぶさってますんで、
and comes clear out into
で
here,
ここまで出てきてますから、
it forms a roof,
ちょうどその屋根みたいになるんです。
which we usually trace as a complete thing.
それで、
All right, now right here
でここですけ
is the
ど、
right and the left
これが右と左、
top of the body
骨
of the
端
maxilla. Now about 5 millimeters below that
で、その約5ミリ下
is the pterygopalatine or the foramen rotundum channel.
1000円個
So
のチャンネルです。
I just put that on there. You
こ
see?
れをそういうふうにつけておきます。
So let's clean this up. Get this all
こ
nice.
れ全部消してきれいにして、
There we are. Now this is all body of the maxilla. This all in here is maxillary sinus.
これは
And I usually will just go in like
普
that
通はこういうふう
and
に
down
入り
again
込んでまた出てきて、
and come in and draw in the center portion of the nasal bone like that.
尾骨の
Now right here you can see the nasal notch.
で、これがネーザルノッチです。ノッチの部分。
So right there is the whole nasal bone.
これが尾骨全体。
Then as I continue this around here, I can see,
で、こういうふう
The
に続
piriform
けていきますと、
and I'll bisect them.
これを
This
分
is
割し
the
ます。
supraorbital.
これがスープラオルビターレです。上の部
So
分。
this is the top of the orbit.
これが眼下の上なわけです。
Looking on the inside, I see the crest on the frontal bone.
で、
That is foramen cecum,
これがフォレイメンシーカムです。
and right there is the crista galli.
それからこれがクリスタギャリです。
Now over on the side then are the two sides,
その隣に両方の、
and those are the plates on the medial border of the orbit.
そうであり
Now
ませ
where
ん。
the crista galli ends right
クリ
here,
スタギャリが終わるところ、
right there,
この部分、
is the cribriform plate,
ここに歯骨板があります。
all the way down here.
この下のところです。
Little sinus
これ、上顎と
developing in this little girl.
少し
Now we'll come back here and we see two key ridges.
次に、
These are actually the cross section of the zygoma.
これは
This is called the key ridge.
これはキーリッジとなります。
Now let's look up in the orbit.
で
I can usually know what to expect to see
で次ここです
by
けども
looking here at these two differences here.
わかりま
because
す。様子がわかりま
Whatever
す。
the differences were here will be in the orbit probably. Now right there is the lacrimal duct. See it?
見えますか？
And here's the body of the maxilla, and right here is the infraorbital canal. Now here's one eyelid,
でこれが眼瞼の一つ。
there's the other.
もう一本がこちら。
Here's the upper eyelid, and there's the other.
これが上と下。
So I'm going to bisect those for tracing.
これをとりあえず
Right there's one orbit, there's the other.
眼
So
下
I'll
の糸
bisect
左。
those.
でこれを
Through the canine.
でこの3番を通して
We look in there and we can see a little
見てみますと、
incisive canal. This is the normal thickness of a palate.
これが
But sometimes you get
でも場合
an
によって
image
は
where it looks very thick. what that usually is the top
それはどうしてかというと、
of the nose on one side and the bottom of it on the roof of the palate on the other side. If there's an asymmetry, one part will be up here and one part will be here. Let's suppose that I have two noses. One is underdeveloped. Then the floor of the nose on that side is
そして
going
そ
to
っ
be
ち側
high,
の鼻腔底は高い位置にあります。
and the normal will be low.
そして正常な方は反対側は低く降りてるんです。
But now I'm looking at the x-ray from the side, and it looks as though I got a big, thick palate. So whenever you see a palate that looks anything other than what I traced
だから
right here,
今
chances are you've got a problem
確
with the
実
palate.
こ
Now just trace the soft palate. Notice
軟
here
組織をトレーシングします。ここですけども、
that the attachment of the soft palate on the underneath side
この下の軟組織の付
is
着部
somewhat forward underneath the palate.
が
Now, we've got the palate,
これで口外ができ
the
て、
upper face.
アッパー
Let's
フェ
go
イスが
back
できまし
and
た。
look here at
次は
the area around the joint. And you see it's oval shaped and it's canted forward. Right there is the internal acoustic meatus. Now, what I want to see here is whether or not the condyle
次に
is on a level here with the Frankfurt plane, and it is.
コンダイ
So right over here then,
これがコンダイル。
it is there. Now we're going to bisect the posterior
次に
outline.
二分していって、
And usually I will trace
普通私やるときは
the cross section of the cortical bone
筆骨の断面図という形
up
で書
to
きま
right
す。
there.
こういうふうに。この高さ
Usually that's by inspection, and that's going to be what I call protuberance menti.
これを
So this is what I just traced. So that we can, usually where I put that when I trace it is what I'm going to use when I draw the line. Now this is the place where most people have the most trouble.
で次にやるところが一番トラブルところです。
And that here is in the coronoid and the sigmoids.
それは大丈夫です。
This gets to be a little hazy sometimes
ここちょっと
because
ぼや
this
け
is
ま
thin.
す。薄いからです。
But we know that a mandible has a little handle on it.
ただこの科学にはこの取っ手のような部分がついてるの知ってますか
So you look hard and you see
ら。
a
よ
little
く探すと
difference between lights and darks right here.
この明るいのともっと暗いの
Lights
と
and darks here,
差の出てるところがあります。
and
こ
lights and darks right there.
ことここ。
So there's where it is.
これです。
Now this has a little handle on it, like
こういうふうにハンドルがついてます。取っ手がついてます。
so. There'd be
これ
the
です。
tracing of the coronoid. This right here is the adenoid.
これがアデノイドです。
This is the esophagus. That's the esophagus. This right here,
でこれは
you can see in the X-ray,
これエクセンで映ってますけども、
is the opening into the trachea. That right there is the arytenoid cartilages.
これ
This right here is the epiglottis. Now I can see here the base of the tongue.
これが舌の基底部。
Now let's look back here.
今度こっち後ろの方。
And this is on the occipital bone.
これが後頭骨です。
This is in the midline.
これが正中。
Now I'm going to try to find
陰の腕
opisthion.
今度はオピスチョンを見つけます。
This distance from here to
こ
here,
こからここまでの距離。
here to here,
ここからここ
should be equal
が
from the center of that
この中心と
to opisthion.
オピスチョンまでの距離
So
と等しく
whatever
なって
this
はいけま
distance
せん。
is here,
だからここの距離が
that's the distance I'd have back here.
こ
So
っちの距離と等しくなります。
that right there is opisthion.
これがオピスチョンです。
This tissue thickness here
この軟組織の
should
厚
be
み
even to this tissue thickness here.
がここの厚さとイーブンで一緒でなくてはいけません。
Now I'll say that again.
もう一回言います。
whenever you have this ball of tissue pulled up,
この軟組織が上に引っ張らさっているとき、
it's lip strain.
必ず口唇に緊張があるということで
The
す。
mentalis is hyperactive.
その
It's pulled this
形になっ
tissue.
ています。
It's pulled this tissue up.
そこで
Usually, when I trace lips, I'll try to make them pretty.
普通はこの唇をかき入れるときはできるだけ可愛くなるようにかきます。
And trace them off of photographs a few
Yes.
times. And I think it'll help you view and imagine where the lips really are. This is the alar rim.
これが尾翼のこの端の部分、リムの部分。
And of course, now I'm not confused with the cheek soft tissue.
で、この胸部の軟組織と混同しないようにします。
Here's the hyoid in an 8-year-old.
舌骨8歳。
And if you'll notice, it is not joined together. It's
まだ
still in 3 parts.
連続していないで3つの部分に分かれています。
So these are the cornu, the hyoid bone. And these just the epiglottis.
エピグロータスだけトレーシングしておきます。
We'll talk about the function of the epiglottis when we talk about deglutition. Now I'll show you how to use the template. And if you notice,
で、これですけ
it
れども
fits、pretty well a first molar, doesn't it? I spent 4 years designing this,
私はこの設計に 4
back and forth
年
until
間費やし
I
ま
was
した。
satisfied. It was until I got tired, actually.
もう試行錯誤何回も繰り返してもう嫌になるほどやってもう嫌だというところでやめまし
Now
た。
what I'm going to do is to bisect the molar also. If they're more than 2 millimeters apart, I trace both of them. You hear that?
右と左、お分かりでしょうか。
Okay. Well, these are pretty well superimposed.
これかなり重なり合ってる症例です。
So I will try to fit this
そ
so
こ
that
でこうやってフィットして
I can just go ahead and very rapidly make a tracing of that too.
これでこの歯が入りました。トレーシングできました。
Now there's the upper second molar,
これ
and this root is just forming.
でちょうど根が形成されつつあります。
First molar roots are not quite all formed yet.
まだ
I can represent that like that. Now the second molar is a little bit asymmetrical.
第二大臼歯多少左右非対称です。
So right there would be a point
これが
bisecting the surfaces.
表面を二分割します。
And usually the second molar has a little different shape. Okay, now we can get these permanent teeth up here.
で今度こっちの永久歯
I usually don't try to trace the upper lateral,
普通は上顎の2番はトレースしません。
but this is a crowded case,
ただこれは創生症例なんで
and I can dot it in freehand if I want to.
フリーハンドで入れてもいいです。
Also, the upper incisor is turned all the way around.
それからこの場合には上顎も背歯がかなり回転しています。
So I can represent it in this way,
でこういうふうにそういう時は書きます。
and if you notice, the apex is not quite all the way closed yet.
まだここでもお分かりになるかもしれませんけど根線が完全に閉じていません。
It's rotated like
こうい
so,
うふうに回転しています。
so that gives me that view of a rotated upper central.
こうしておけば上顎一番が回転捻転しているというのがわかるわけです。
Now, actually, if you look at the X-ray, you'll find that there's
次に X 線
I
見ていた
see
だきます。
1, 2, 3 teeth. Can you see
3
it?
本。
What do I want this to represent?
これで何を表現したいでしょうか。
The average position of the 4 lower incisors.
化学
So
摂
I'm
氏
going to
4
trace the
本
middle
の
one. So that's going to represent the mean position of all 4 incisors. Up in here is the
こっちは
features portion of the temporal bone. So now the only thing I have left to do
あと残りは
are the deciduous teeth.